Good evening. Thank you all for joining us this evening. My name is Nima Hussain, and I will be chairing this meeting, the ZeroCovid Coalition. We have a great lineup this evening, many of whom have been long-standing advocates of zero COVID. As you all know, Dominic Cummings may or may not be a likable man, but that is not the point. His testimony has not been refuted or even denied, and cases are rising sharply once more. So the ZeroCovid Coalition and many others feel vindicated, but we wish we were not. Because at the very least, this means that many more people are going to get seriously ill in this country and in others where reopening is only accompanied by vaccination. So the theme of tonight's meeting, why we still need zero COVID, will be explored in greater detail. If you do have any questions, please do submit via the Q&A function, and we will have a Q&A session at 7 p.m. If you want to tweet about the meeting, our hashtag this evening is still zero COVID. That's hashtag still zero COVID. Our first speaker needs little introduction. It's Labour MP and co-founder of the ZeroCovid Coalition, Diane Abbott. Diane will give a general overview of the current situation and some pointers to tonight's speakers. Diane?
Thank you very much, Nemo. Well, thank you everybody for coming. And as you've heard, the theme of the meeting is after Dominic Cummings' revelations, why we still need zero COVID. The Cummings revelations in particular, that the Prime Minister and his Health Secretary were really thinking about herd immunity as a goal, were not surprising, but they were shocking. After all, some of the Prime Minister's leading advisors were on the record, on the television, talking about herd immunity. Dominic Cummings said that the actual policy was herd immunity by September. And remember, they didn't even have a vaccine then. So this was so-called herd immunity by infection, disease, and death. Cummings also said the Prime Minister had said he was willing to let the bodies pile high. And pile high is what happened. On the narrowest possible measure, there are 129,000 deaths in Britain, one of the worst per capita death tolls in the world. And this was after the government had seen the virus spread beyond Asia and seen the carnage in Italy. What is very telling in all this is that these accusations have not been refuted. They have not even been denied. Today, the Health Secretary told us that when Boris Johnson called him effing hopeless, Boris Johnson was very stressed. Well, we don't need either Boris Johnson or Dominic Cummings to tell us that Matt Hancock is effing hopeless. We know that. But what it tells us is that Hancock is indirectly confirming the Cummings allegations. The allegations are true. Cummings has the documented evidence in WhatsApp messages, and we have the catastrophic public evidence in front of our own eyes. And now, cases and hospitalizations are rising once more. Cases are rising very sharply, and I will leave it to Deepti and others to explain the slower pace of rising hospitalization, though this may be to do with the fact that victims are now younger and maybe more robust. The government's own data tells us that the R rate is above 1, which means that the infection rate is accelerating. Over 200 people a day are being admitted to hospital with COVID. Just about a month ago, it was less than half that. All too easily, the NHS could be overwhelmed once more. We know too that throughout the crisis, certain communities have been hardest hit in terms of infection rate and death toll. Black and Asian communities have been hardest hit, nothing to do with genetic factors, but social factors. In Britain, this pandemic is hurting poorer communities more. Richard Horton of The Lancet calls this the syndemic of poverty, the combination of poverty, deprivation, discrimination on one hand, intertwining completely with the spread of the virus on the other. This is true on a national scale, and it's true on an international scale. We have the grotesque spectacle of G7 leaders, some of the wealthiest countries in the world, including our own Prime Minister, claiming they're going to vaccinate the world. But they've only pledged enough to vaccinate a fraction of the world's population. And if these pledges are anything like their pledges on climate change, these doses of vaccine will never materialize at all. Right now, as we speak, people are dying in huge numbers in Argentina, in India, in Malaysia, in South Africa. The refusal to waive the patents on the vaccine is killing people in huge numbers now. And the continued refusal to waive the patent will kill many more. It seems that for wealthy G7 countries, the profits of the drug manufacturers are more important than human life. But it is never too late to do the right thing. We can still adopt the zero-COVID strategy. Our opponents say we want permanent lockdown. That's completely untrue. The accusation is completely misdirected. A zero-COVID strategy with a rigorous lockdown only as the very first step needs only 6 to 10 weeks to take effect, as Professor Anthony Costello has shown us. But we need many other measures for a zero-COVID strategy. We cannot go on like this. There is an alternative, but we need to fight to make it happen. We need to fight still for an effective zero-COVID strategy. Thank you. I'm very much looking forward to hearing the rest of the speakers tonight. Thank you very much, Nima.
Thank you very much, Diane. Our next speaker is Dr. Jeremy Rossman, Senior Lecturer in Virology at the University of Kent. He is speaking on behalf of the International Zero-COVID Alliance, which is about 30 affiliates in 15 different countries. Jeremy will be able to give an overview about the current situation in the UK and how that is both a warning for other countries and a reminder that we can no longer not solely rely only on vaccines to stop the pandemic, but need to support the vaccines with a zero-COVID strategy. Thank you, Dr. Jeremy.
Thank you very much. It's my pleasure to talk to you today. And I want to talk about the current situation in the UK, because until very recently, the UK was holding steady at a fairly low level of viral cases, at less than 2,000 cases per day. And that was leading us towards reopening that was supposed to happen today. And part of that is due to a really incredible vaccination campaign, where in the over 18 age group, over 80% of the population has had one dose of the vaccine, and nearly 60% of the population has had 2 doses. And yet, despite this, right now we are seeing a steady rise in cases. We are nearly 10,000 cases per day, and the number of cases is rising steadily. And this has led to a delayed reopening. So the question is, why? What has happened in the UK, and what is the implications of this for the rest of the world? So to start with, part of the reason for this is a reliance on the vaccine as a way to control the pandemic. And this has been combined with the steady rise of the Delta variant that is now the dominant variant within the UK. Now, the vaccines are still very good at protecting against symptomatic COVID disease when you have 2 doses of the vaccine against the Delta variant. So the Pfizer vaccine with 2 doses still gives an 88% efficacy at preventing symptomatic COVID disease. AstraZeneca is at 74%. And both of the vaccines are still very good at preventing hospitalization and COVID fatalities. But the problem here is that when you go down to one dose of either vaccine, the efficacy and the ability to prevent symptomatic COVID disease goes down dramatically. So with the Delta variant, the Pfizer vaccine with one dose only gives 36% efficacy, and the AstraZeneca vaccine only gives 30% efficacy. This presents a significant portion of the population at risk of COVID disease. But this is even more dramatic when we factor in the fact that only people over 18 are being vaccinated, and it is likely going to be many months before children are able to be vaccinated. This puts children at a significant risk because we know that even though children are at a lower risk of severe COVID disease, they can be infected, they can spread the virus, and they are at still risk of protracted symptoms in the form of long COVID. And this is even more dramatic in areas that have reduced school precautions. So there is a significant risk. And this is even more dramatic with the recent observations that the Delta variant seems to have a 2 times increased rate of hospitalizations in people that have not been vaccinated or have had one dose of the vaccine, and a 60% increase in transmissibility compared to the already enhanced transmissibility Alpha variant. So this is causing the significant rise in cases in the UK. And this has even more dramatic consequences when we think about this globally, because many countries in Europe have lower than 30% of their population having received 2 doses of the vaccine. When we look globally, that rate drops significantly, and many countries have barely even begun the vaccine rollout. And yet, despite this, we are seeing the Delta variant in over 80 countries worldwide. In the US, the Delta variant is already 10% of the cases, and it's expected to be the dominant variant worldwide soon. And this is bad enough with the Delta variant, but what happens next? What's the Lima variant going to look like? And what are the implications for countries that are relying solely on the vaccine? So what is the solution? The solution here is actually very straightforward and something that we have been talking about for a long time, which is to use the vaccines because they are still extraordinarily good, but to support those vaccines with a zero COVID strategy, driving cases down to allow more time to fully vaccinate the population, all ages that are eligible, and to vaccinate as many people worldwide as we can. And we can do that. We know what we need to do. We know that we need a functional, local, find, test, trace, isolate support system. We know we need very good community messaging and continued community precautions like mask wearing and social distancing and awareness of what to expect, what the future is going to look like, what people need to do even after being vaccinated. We know we need precautions in businesses and especially in schools where we have a significant proportion of the population that is not going to be able to be vaccinated anytime soon. We need mask wearing. We need continued precautions. We need to look at ventilation and really try to protect people that are not able to be vaccinated. We, of course, need travel restrictions, including testing and quarantine for incoming travelers. When cases are high, we need local supported lockdowns. And importantly, we need to continue the vaccine rollout, but focusing not just on getting one dose to as many people as possible, but to making sure that we get as much of the population vaccinated with 2 doses for all eligible ages, but not just in the UK. We need to do this globally. We need to focus on vaccine equity and making sure that we are protecting everybody. because the virus is going to continue to spread and continue to evolve. And the best way to protect ourselves and to protect everybody is to ensure good reduction of virus transmission globally. We have the tools, we know what to do, and we can support the vaccine rollout with a zero COVID strategy. So thank you very much.
Thank you very much, Dr. Jeremy Rossman. Thank you for that. Now we have a short video from Bel Ribeiro Addy MP, who unfortunately cannot be with us this evening, but wanted to send us this message.
Thank you for attending tonight, and thank you to the ZeroCovid Coalition for inviting me to speak. I'm really sorry I can't be here in person, but I hope this video is a good substitute. Now, I agree with the foundation of this campaign and have supported it throughout. I thought then that zero COVID was the only feasible strategy to actually suppress the virus, as other countries have done, and I still believe that now. In fact, after Dominic Cummings' testimony, the case for zero COVID couldn't be clearer. Why do we have, on the narrowest measure, 128,000 people dead, and millions who have contracted the virus, and enormous numbers of people with long COVID? The answer is that this government's policy was herd immunity, the bodies have piled higher, and cases are rising once more. This is all a consequence of government policy. Now, you don't have to like Dominic Cummings in assessing his evidence, you simply have to judge it in relation to the rebuttal, the counter evidence, and the fact that there is none. The Prime Minister and his Health Secretary, who I might add he describes as effing useless, neither of them have offered a rebuttal to Cummings' evidence. Instead, they've simply got others to rubbish his motives, as rubbish as they were. Now, they've not even denied these allegations in the House of Commons, presumably because they're afraid that he's gotten written or recorded evidence of it, which then becomes a matter of whether or not they've broken the ministerial code. But I want to focus this evening on another aspect of the current pandemic, and that's an international one. It's an issue I'll be aiming to raise in Parliament this week. It's a startling fact that lower income countries have been provided with hardly any of the world's distributed vaccines. Africa, for example, has received just 3% of the world's vaccines, yet Africa's population is over 1.2 billion people. That's 1 in 6 people, almost 1 in 6 people on the planet are on the continent of Africa. And the same is true of other countries in the global south in terms of how many have actually received vaccines. The reason for this is simple. The governments of rich countries are hoarding the vaccines for themselves. And scandalously, they're also blocking waivers of vaccine patents at the WTO. Joe Biden, thankfully, has done a U-turn on this and now supports the waiver. But other rich countries in Europe, which are home to big pharma companies, are still blocking this waiver. And the leading culprits at the moment are Germany and our own British government. Yes, our own British government, whose leader said at the G7 that he was going to lead the G7 in vaccinating the world. We are now key players in vaccine hoarding and in blocking the vaccine patent waiver that would actually go a long way to giving immunity to the rest of the world. Now, as the WHO says, and as Gordon Brown has said, this is catastrophic moral failure. It's already leading to a huge number of global deaths and will lead to many more. Cases are surging once more in Malaysia, in Argentina, and in many other countries, and deaths are surging in India, and the head of the WHO in Africa reports that the continent is facing a third wave. Our governments are letting this happen. The patent waiver is crucial. It would allow global mass production of vaccines, meaning these would be available very cheaply, affordable even for poor countries. The purpose of patents is to prevent that so that big pharma can make big profits, often from the research supported by the public sector and delivered by the public sector. At one point, UNICEF estimated that the volume of output, if we waived the patent, could be as much as 20 billion. At the moment, the manufacturing capacity that Pfizer, Moderna, and AstraZeneca have combined is only 3.2 billion. Now, there's huge manufacturing capacity in countries like China, India, others in Asia, countries like Brazil, Mexico, and South Africa. It's no use the G7 promising 1 billion doses at some point in the future when people are dying right now. And 1 billion doses means that 500 million people could be vaccinated. What about the other 7 billion? The truth is that we can't put faith in this pledge, and governments who let their own populations die as they've tried to keep the economy open for business obviously cannot be trusted to act for others. Countries like our own, unfortunately, are continuing to keep people in this kind of neo-colonial grip where they're going to be gifting these life-saving vaccines as opposed to actually allowing people the opportunity or other countries' opportunity to produce them and sell them to them. And even if altruism was completely sorely lacking, it should be obvious that it's in everyone's interest to tackle this. As the BRICS People's Vaccine Campaign says, no one is safe until everyone is safe. And the British government, above all, should be able to see this, having seen the ravages of both the Alpha and the Delta variants. Now, we've been lucky, and in the case of a pandemic, we shouldn't, be looking towards luck. We've been lucky that so far all of the different variants that come up still respond to the vaccine in the right way. But we're already seeing this Delta variant is targeting younger people. We're seeing a greater increase in infections and transmissions rather amongst younger people, and that's clearer than ever that the virus is changing. How soon before the virus gets to a point where it no longer it offers the vaccines that we already have no longer offer that protection? We are really, really on dangerous ground here. Now, no matter what we may be told, there isn't actually a scarcity of supply. It's completely artificial. There's a scarcity of common sense, definitely, a scarcity of compassion, morality, global cooperation, and of course, a never-ending supply of greed. And then there's that other really, really offensive argument, which I've heard, is that we can't just have anybody making the vaccine, or, even if we did waive the patent, we can't even be sure that these countries could, properly make the vaccine. That same kind of dog whistle argument basically says, can these black and brown people make the vaccine, as if some of the finest minds in science and technology do not also come from the global south. Now, overall, this is just one of the greatest moral scandals of our time. We can and we must demand that this is ended. We must say that, this doesn't happen in our name, and we need to make sure that we vaccinate the world, and we need to do it right now. So thank you very much for listening this evening, and I look forward to joining you in the future.
That was great from Belle. Yes, there is definitely a scarcity of common sense, but not a scarcity of resources. Thank you, Belle. That also leads neatly to our next speaker, who is Nick Dearden from the People's Vaccine Campaign, which campaigns for vaccine justice on a global basis. Nick?
Thanks very much, Nemo. Thanks for inviting me. Belle said so much there, so let me just add a little bit to it and say, congratulations on putting the event together and all the work you're doing to expose the atrocious approach to human health that this government has exposed itself to over the last 18 months. And as Dominic Cummings himself has made really clear, I think we really need to do all we can to amplify the problems of the Johnson government, because I don't want to live in a country where human life comes secondary to the supposed demands of the market. This country's implemented such policies throughout much of its history, and it's time that we stopped it. It's not acceptable, so let's put forward some alternative models. And as Belle quite rightly said, the alternative models are out there, and in many ways are an aspect of common sense. What we're seeing here is a government putting market principles and the profits of big business ahead of what I regard really as not particularly radical, but actually common sense proposals to end one of the worst pandemics that we've seen in the modern era. And obviously, I want to talk not just about the failure of domestic policy, but the failure of international policy, because as Belle rightly said, the fact that dangerous variants are spreading now sure is related to some aspects of domestic policy, airports policy and so on, but just as much it's related to the fact that most people in most countries of the world are nowhere close to vaccinations. And why is that? Because we have handed over the coordination of the vaccine rollout to a sector of society, big pharmaceutical corporations, which it's been known for a long, long time are highly dysfunctional. I mean, this isn't just a critique from the left. Look at what Lord Jim O'Neill, a former Tory lord and bigwig at Goldman Sachs, has said. He said for years now, the pharmaceutical sector is dysfunctional, and if we're not very careful, it will come to be regarded very much like the big banks were regarded after the 2008 financial crash. These companies spend more each year handing out dividends to their shareholders and buying back shares to keep their stock price high than they do on the research and development of new drugs. And at the heart of this is absolutely an intellectual property system, a patent system, which was invented by pharmaceutical corporations in the mid-90s, which allows them to sit on innovations and not share them for a period of at least 20 years. And that doesn't encourage, as they argue, important innovation. It encourages profiteering. And in fact, what you find is that most of the new really important medicines, life-saving medicines that are needed around the world, are not primarily funded by these corporations. They are funded by the state. They are funded by our taxes. They are funded by the public sector. And that's exactly what we've seen in this pandemic. So, even the better end of the company spectrum, AstraZeneca, virtually all of the R&D that went into that vaccine, the Oxford vaccine, as we should really call it, came from the public and charitable foundations. Moderna in America, almost entirely funded by the public sector. Yet we then simply hand that vital knowledge over to big corporations and allow them to sit on it for a very long period of time indeed. And in fact, the Labour government, the Labour Party in 2019, and Diane will remember this well, pledged to change that system, pledged to put in place a medical research and development system that would put human health ahead of profiteering. And if only we'd begun to carry out those reforms, we might not be in the mess that we're in now. Now, many people foresaw this. This isn't the first time that Big Pharma have behaved in this way. So many people foresaw this at the beginning of the pandemic. And that's why we set up a number of mechanisms. Firstly, importantly, the COVAX facility, which was supposed to allow a degree of fair distribution of these vaccines when they were invented. They hadn't been invented then, when they were invented around the world. A very nice idea. Unfortunately, what happened was governments like ours bought up every potential vaccine on the market and there was none left, or very few left, for COVAX to purchase. And today we are sitting on way, way, way more than we need, at least by the end of this year. I'm not saying we have them in our pocket at the moment, but by the end of this year, we will have many times what this country needs, while other countries are completely unable to even vaccinate their health workers, their frontline health staff. So that's the first problem. There was another mechanism, though, which is equally interesting, that was set up called CTAP, the Coronavirus Technology Access Pool. And the idea of this was that the medical research behind this was not only publicly funded, but was simply too important for big pharmaceutical companies to sit on and profiteer off. And so the point of CTAP was to have somewhere where you a kind of one-stop shop where you could lodge all of that knowledge, and factories around the world which wanted to produce and were capable of producing, and of course could produce safely, could come and get the knowledge and learn about it and begin to produce. Sadly, every big pharmaceutical corporation in the world today has boycotted the CTAP facility. So CTAP at the World Health Organization has none of the knowledge behind these drugs, because Big Pharma thought that its profits were more important than sharing this information. And the result is that we have factories around the world. In Bangladesh, there's a single factory that could be producing 600 to 800 million doses a year of a vaccine, is unable to produce because no one will share the technology with it. Indonesia, 600 million, again, in one factory. There are factories here in Europe, in Denmark. There's a factory in Canada that wants to produce. It wants to produce for Bolivia, actually. It's trying to override the patent system, but no one will share their technology with these factories. So it's an enforced restriction, an enforced scarcity of supply that's been placed on the world precisely because it's what Big Pharma has demanded. There are parts of the world, while hopefully most of our population will be vaccinated by the end of this year, there are parts of the world on current trends that would take 57 years to vaccinate their populations. The low-income countries suffering, of course, unsurprisingly, the worst of all. Meanwhile, one corporation, Pfizer, is set to bring in $30 billion from its vaccine this year. And over the next 4 years, will bring in $90 billion, making it the highest profiting medicine of any sort in history. This is absolutely extraordinary. And it's really very clear that we need to do all we can to override these patents, to create what we call a people's vaccine, and to support the ramp up of generic manufacturing around the world, because it's patently clear now that most countries in the world cannot rely on getting their supply of essential medicines from the 10 countries where they're currently produced. We need generic manufacturing hubs around the world, and we should be supporting that. Now, Boris Johnson has said, don't worry, we're great. The contribution we've made to COVAX is fantastic. It's obscene. It beggars belief. This country has not donated yet a single dose of vaccine. We have not exported a single dose of vaccine. And yet we are one of the premier countries in the world standing in the way of countries being able to produce their own. This will not be solved by charity. It will be solved by justice. It will be solved by challenging this trade system, which is very, very good at keeping the profits of big pharmaceutical companies high, and very, very bad at meeting the health requirements of the world. So please join the campaign. I'm from Global Justice Now, as well as People's Vaccine. You can find out how to get more involved there. And let's keep pursuing this strategy of putting human health above the demands of the market. Thank you.
Thank you very, very much, Nick. That was really informative. Next, I'm delighted to welcome back Dr. Deepti Gurdasani. She's been a leading and trenchant advocate of the case for a zero COVID strategy, which, as we know, has not always been a popular policy. We are also extremely fortunate that she will be able to do a short Q&A session after her presentation. So please, if you have any pressing questions, please put them in the Q&A function and we will try to address your concerns. Dr. Deepti.
Hi, I'm just going to share a short presentation to sort of, discuss where we are right now and, where we go from here, and the sort of gambles that we appear to be taking, which I'm quite concerned about. So where are we? In terms of the pandemic, we haven't done very well compared to many other countries. About 2 in 1,000 people in our population have died of COVID, which is quite significant. We've had over 150,000 deaths. And unfortunately, we have 1 million people now living with long COVID, which for many is very debilitating and has significant impact on their day-to-day lives. This is sort of recent data showing that we're now once again, for the 4th time, I guess, seeing an exponential rise in cases, which is being described as, the 3rd wave. Cases are now doubling every 11 days. So quite significant and rapid increases in cases. And very unfortunately, despite the level of vaccinations we are seeing a rise in hospitalizations as well, predominantly in the under 65s. In terms of vaccination, I think we need to remember that while we have a significantly high level of vaccination, only 46% of our population is fully dosed. And even those who are double dose are not fully protected. 20% have received only 1 vaccine. And unfortunately, in the midst of this, we've also managed to sort of not just import a variant, but get a variant established into our community that's now almost replaced our previous variant that has significant escape from vaccine. So while it provides significant protection against severe disease, which is very, very good, the protection against transmission and infection is reduced, and that has important implications for our pandemic response, which I'll be coming to. So why am I so concerned about vaccine escape when, public health England studies are showing that, we might have above 90% protection against hospitalizations? Well, this is why, because, don't want to go a lot into these plots, but essentially to show that these are sort of different variants that we have. And if you look at this plot, this is the Delta variant, and you can see that these lines, which represent the level of immunity or neutralizing immunity, is lower. And this is what happens to immunity over time. So generally, immunity declines over time. So this is from 25 days to 100 days. And the other thing that we know is that immunity is lower at baseline. So starting immunity, even with vaccines, is lower in older people. So what we're seeing is, and this on a log scale, so while these differences look small, they're actually quite large. So for example, the Delta variant reduces the immune response by about 6-fold. And this graph sort of shows you where different people will start at their level of immunity. So if you're young, you might start here, for example, and even if you have a reduction, your reduction might not be that significant, and you might end up in a place where you're still protected. However, if you're older or you have other morbidities like diabetes, that make you start off at a lower level, it means that you might have enough reduction so that in a given period of time, you lose that protective immunity. So that means that our immunity in older people who are actually double vaccinated quite early on and have actually passed this period, for many of them, might actually require boosters very soon. And it also means that while there is a level of immunity against severe disease that's preserved, you might still be able to get infected and transmit, which is very, very significant when you're trying to get to a population level of immunity, given there are many people who are not vaccinated, and there are people who are not eligible for vaccination in this country. So let's talk about the Delta variant. The Delta variant, there's no doubt, has changed the shape of the pandemic in the UK. This is a variant that's 60% more transmissible. It's 2 times more likely to cause hospitalizations. We still don't know how much more it increases the risk of death by, but that could be similar as well. And we know that it escapes vaccines to a moderate degree. And the question is, how did this enter the country? So this is SAGE documents from the 21st of January that essentially verbatim say, no single intervention other than a complete preemptive closure of borders or the mandatory quarantine of all visitors upon arrival in designated facilities can fully prevent the importation of cases and new variants. So the government knew this very, very clearly in January. But of course, they felt it was okay to import variants because they felt that their surveillance or surge testing would be able to prevent them getting into the community. Of course, we all know what happened since, and we know that even after this variant was designated a variant of concern in India on the 25th of March, it still took us 4 weeks to place India on the red list. And although placing India on the red list would not have prevented this variant coming into the country, because we know now that was present here in February through retrospective sequencing of samples, it may have reduced the number of times it was seeded into our community. And of course, now we are looking at this third wave, and I hear a lot that this is linked to the Delta variant. It couldn't have been predicted. But let's look at some of the SAGE minutes from February 2021. So this is before this variant was known to have entered the country, well, before it was actually detected in the country. And these minutes, which is prior to the announcement of the 22nd of February, which was our lockdown easing plan, clearly says that there will be an epidemic resurgence unless vaccines are highly effective at reducing transmission. Of course, we have a double whammy because now we've also imported a variant that reduces vaccine effectiveness. And vaccines do not provide perfect protection, and coverage will not reach 100% of vulnerable. So there is a potential for such a resurgence to be very large. And this is imperial modeling that clearly showed that there would be a substantial number of hospitalizations and deaths across all scenarios put forward, including the scenarios put forward by government. So we need to remember that when the government made the announcement of lockdown easing on 22nd of February, these are facts and this information that our government had even at that point in time. Of course, the Delta variant makes this much worse. So these are minutes from SAGE on the 12th of May, and this is before the announcement made on the 13th of May for stage 3 to go ahead, which was the 17th of May easing of lockdown. So even at that stage, SAGE warned that there are still too few adults vaccinated to prevent a significant resurgence that could put unsustainable pressure on the NHS without mitigatory measures, so non-pharmaceutical interventions. And they said if step 3 alone is taken and this variant is more transmissible, then we could see a resurgence in hospitalizations the size similar to that seen in spring. And of course, then if we go ahead with stage 4 as well, then the peaks could be double that seen in January. So this was before May 17th, when the government was warned that even going ahead with stage 3 would have a huge impact on the NHS. What did the government do on 17th of May? They went ahead with stage 3, claiming they were following the data. And what happened after that? We saw this variant rapidly spread in school-age children all while government was denying transmission was happening in schools, and while government had gone ahead and removed the most basic mitigation measures. So masks in secondaries were removed on the 17th of May. And what we see here is a graph from Bolton, and red is essentially bad. And what you see is that the earliest rises happen in secondary school children, which are then followed over time by other age groups. So it's very, very clear that this pandemic of Delta spread in the community and it becoming dominant has been facilitated by the lack of mitigations in schools. You can see that on the 19th of May, the infection rates in secondary school children are about triple the infection rates in 20 to 29-year-olds. And of course, I think one of the reasons that the government never focused on getting transmission under control. So if you look at the lockdown easing roadmap, containing transmission, keeping cases low or keeping R below 1 was not part of the roadmap at all. The only aim of the roadmap in terms of transmission was that the NHS should not break. But transmission is very, very important. And we know that even people with mild symptoms develop long COVID. We know that 13% of those who are infected will go on and develop symptoms that last 3 months or more. And among the 1 million people now who are suffering with long COVID, the majority are formerly young, healthy, majority are women. And we know that about 2/3 of them have impact on day-to-day functioning. So this is not a mild sort of syndrome. And almost 400,000 have had symptoms for more than a year. So while I'm saying 12 weeks or more, many of them have symptoms lasting 6 months or over a year. And we don't even know if this is reversible for some of them, and some of them will ever recover. Recently, there was a study published as a preprint just a few days ago, which I haven't seen covered in the media, but is very significant. This is a study from the UK Biobank, which is a group of healthy people who have been recruited into this research study over time. And many of them have sort of baseline scans that are normally done, MRI scans, brain scans that were normally done as part of this research. And subsequently, some of them have had a positive COVID test. These are not people who've been hospitalized. Very few of them are hospitalized. And they've now been compared with people who did not have a confirmed COVID test. And they've been scanned again. And looking at their brains, what we find is people with COVID have a significant loss of gray matter in their brain, in particular areas of the brain that are associated with smell, associated with memory, associated with emotion, which we know are the typical symptoms that are reported by people with long COVID: difficulty in concentration, problems with memories, difficulty with smell. And this is really, really significant because we are seeing this in a population of people between 40 to 80 years old who have mild symptoms. And transmission is also really important because we know that virus adaptation is continuing. So if you look at the data that Public Health England puts out every week, what we're seeing are new mutations on top of the Delta variant. And we now have cases of the so-called Delta Plus variant within the UK, which is the Delta variant with one of the mutations of the Beta or so-called South Africa variant that we're quite concerned about. And while we're keeping a close eye on numbers, if we let transmission continue, it's very likely that more and more mutations will evolve on top of Delta, and also more new variants will evolve. And with the pressure of vaccines alongside transmission, it's very, very likely that we will see adaptation towards escape unless we slow transmission down. And of course, we're already seeing an increase in hospitalizations and deaths. We're already hearing that there are A&E departments that are being overwhelmed and seeing cases at the level of January. And we need to remember the NHS doesn't have any capacity. So this whole idea of NHS at breaking point, which is, we think of as shortage of oxygen, ICU beds. By the time we get there, routine care has been massively compromised. And our NHS is already struggling after 2 devastating waves. And we cannot afford to put any more pressure on it. Not even, 200 hospitalized people in hospital, daily hospitalizations, which is what we have right now. So what we need is a multi-pronged strategy. And, our government really likes to compare with Israel in terms of vaccination and where Israel has gone, without actually understanding that Israel was very, very cautious about reopening alongside vaccination. In fact, 80% of the adult population was fully vaccinated before they actually opened schools. And until very, very recently, they had mask mandates everywhere indoors, including in schools. And, we've diverged from Israel, as you can see here. because we're experiencing an increase in hospitalizations, as was inevitable and warned by literally all scientists who were paying attention, as well as SAGE. So what do we need to do? We urgently need to get on top of transmission, because we have focused on a vaccine-only strategy while doing almost nothing to protect it from new variants. So, we didn't put in managed quarantine and comprehensive restrictions on our borders, and we haven't contained transmission to prevent new mutations emerging. And given vaccines are our only strategy, if we have one escape variant emerge that escapes vaccines to a high degree, that would scupper all the gains made in the last 6 months. So it's a huge gamble to be taken to let transmission continue. We need mitigations in schools and workplaces where transmission is happening extensively. Schools are one of the major areas of spread, with the largest number of outbreaks happening every week across all settings. And in the midst of this, of course, there are unethical trials that are going on to replace isolation with very suboptimal lateral flow tests that even the MHRA has said in the past should not be used for this purpose. And rather than making workplaces and schools safer, we seem to be looking at policies that would increase attendance in schools and workplaces while putting people at risk. We still have a test, trace, and isolate strategy that's not working, that actually failed us right in the middle of spread of the Delta variant to the Northwest very recently. And of course, we still don't have adequate support with isolation. And 1 in 5 people who are symptomatic are coming forward for testing only because they can't afford to isolate. So clearly, if people aren't getting tested because they can't afford to isolate, we cannot break those chains of transmission. There is no point having mass testing or asymptomatic testing if people who are symptomatic don't feel they can come forward for testing. And
Professor Gurdasani, sorry, I'm really sorry to interrupt you there. We're going to have to move on to the Q&A portion of this, if that's okay.
Okay.
That'd be okay?
Okay, there's just one thing I want to say before. Okay. One of the things that I've become really, really concerned by is a lack of transparency and what I see as unethical experimentation that's happening. And I mentioned that we're looking to sort of have policies where people who are vaccinated have, more freedoms. They don't have to isolate if they are contacts. We're looking to replace isolation for adults and children with suboptimal testing. And all of these would essentially be putting people at risk while avoiding, putting in place safety measures in these places to actually contain transmission. And we keep hearing about living with the virus. This is something we keep hearing from our government, but I want to know how it's possible to live with a virus that's adapting so quickly and potentially holds such a risk to our public health. And I think living with the virus is another name for a policy of focused protection, which is vaccinating our vulnerable and then letting it rip. So herd immunity through infection, everyone else, because there's it's very difficult to see this in any other way, because there is absolutely no focus on containing transmission in other groups, as well as vaccinating children, which many countries are doing much, much better than us. And I'll stop there.
Thank you so much, Professor Gurdasani. We've got a few really, really good questions. We've got quite a lot of questions, but we won't have time to do all of them. Just want to ask, this one keeps coming up a little bit. So the government are heavily pursuing a vaccine-only strategy. What are the risks of that strategy? Are there any examples of vaccines doing all the heavy lifting? Some people point to Israel as an example. What do you think about that?
Yeah, so I had a slide to put up actually that I didn't manage to, but Israel has recently had a fairly large outbreak of the Delta variant, which is really, really concerning in their schools. That has impacted a lot of vaccinated people as well. But Israel hasn't followed a vaccine-only strategy, and countries that have followed a vaccine-only strategy thus far have not been successful. Even if you look at countries like Seychelles, Maldives, you're seeing cases surge who have similar levels of vaccination to us. You're seeing cases surge to very, very high levels. And that's what's going to happen here, because you need extremely high levels of vaccination to prevent surges like that, almost to the level of 100%, particularly with such a transmissible variant. So you cannot abandon all measures and hope vaccines by themselves are going to do their bit, especially when you import highly transmissible and escape variants. There's no country so far that has achieved herd immunity through vaccination at this point in time.
Okay, thank you. Another question that's coming up quite a lot now is that, so COVID vaccines haven't been approved for children. How should we approach the issue of vaccinating and protecting children?
So I think vaccinating children is very important. I mean, we keep hearing from JCVI that the risk benefits are not clear. And, unfortunately, members of JCVI believe that children don't contribute much to transmission, don't get impacted. And also that the safety criteria are not met or, are not clear. Actually, in the US, and this is not widely discussed, but over 4 million children under the age of 17, including about 600,000 between 12 to 15 years of age, have already been vaccinated. And, vaccines are being used to vaccination in many countries now, US, Israel, Canada, and many European countries, including Italy, Germany, have already approved these for children in some capacity. And there are many benefits to this. Children do suffer from long COVID. So between 7 to 8% of children have persisting symptoms for 12 weeks or more. And some of them are debilitating. They also suffer from significant educational disruption. So, while this pandemic was surging in Bolton, 1 in 3 children were absent for COVID-related reasons. And of course, children also transmit to the community, to parents. And unless we vaccinate children, we're very, very unlikely to be able to get on top of the pandemic in any way. So I think for the benefit of children, as well as the benefit of wider society, and also to prevent further virus adaptation, it's very, very important that children are offered the vaccine, particularly because there are no mitigations in schools, and it's mandatory for parents to send their children to school. So there is no way to keep children safe in our current environment. We're almost forcing parents to expose children to this virus while offering them absolutely no means to protect their children or their families, particularly clinically vulnerable children who have absolutely no way to protect themselves in this.
Thank you. I know you've touched on this a bit, but could you give a brief rundown as to the driving factors behind these new variants that are emerging?
So the driving factors between variants is essentially transmission, because the virus mutates randomly and it mutates as it transmits. And the more transmission we let occur, the more likely that there'll be one random mutation that comes up that's either more transmissible or more severe or more likely to escape vaccines. And those are the mutations that get selected over time, because if they're more likely to transmit, they float to becoming more dominant over time. If they're more likely to escape vaccines, then in an environment where we have partial immunity, they will also float upwards over time. And that's essentially what will normally happen if you let transmission continue, particularly if you let transmission continue alongside vaccination. It's like playing the lottery. If you play the lottery once, your chance of winning is almost zero. But if you play it 3 million times, your chance of winning the lottery increases. And that's what we're doing for the virus. We're letting it buy 3 million tickets so it can win the lottery.
That's a great way of putting it. Thank you. The last question that I've got here is, the pandemic has led to a lot of misinformation and confusing messaging. One claim that's is often seen is that the severity of illness is influenced by vitamin D levels more than anything else. How should we respond to this?
So, I mean, I understand why this hypothesis became dominant, but there is absolutely no evidence right now of a causal link between vitamin D and COVID severity. In fact, we have good genetic, they call Mendelian randomization studies, where essentially all of us had these normal mutations in our genes, which produce different levels of vitamin D in our body. And we found that people who have higher levels of vitamin D are not necessarily protected against COVID. Even trials of vitamin D where vitamin D supplements are used have not borne out this sort of hypothesis. And the reason for these sort of things is whenever we have markers like vitamin D, iron, selenium, zinc, all of these are associated with many other factors that are also associated with COVID severity. For example, we know ethnicity is associated with COVID, but the major driver of that is essentially social and structural. But that's also associated with vitamin D. People who are sicker or have other diseases often have lower vitamin D levels as well. So it seems to be a marker for severe COVID rather than something that's actually causing it, because in studies where we supplement or when we look at people's genetics, which is randomly assigned and not associated with these factors, we don't find a relationship between vitamin D and severity of COVID. That said, of course, it's good to have normal vitamin D levels, so it's fine to take supplementation, but I don't think we should think that necessarily that's going to solve the problem.
Thank you so much, Professor Gurdasani. That was excellent. Thank you. I'm sorry we didn't get to all the questions, but we have taken note of them and we'll try to address them at our next meeting.
Sure, sorry, can I just add one bit of the misinformation, because that's something I wanted to mention in my presentation. And one of the things I've become very concerned about is the misinformation that's being spread. And it's also confusing because some of it comes from the scientific community as well. And there are also bodies that we are seeing are public health bodies, for example, within the UK, where there's been less than ideal levels of transparency around what's happening. So, for example, a lot of these trials that are happening are sort of being done by the Department of Health, Public Health England, approved by the Public Health England Ethics Committee. We also know, for example, that the Department of Health has been responsible for suppressing certain data from Public Health England and also changing Public Health England guidelines around things. And I've become very, very concerned that we're in a situation where it looks like our public health bodies that actually advise on the pandemic and are supposed to look out for our health are beholden to some extent to our government. And I think that is becoming really, really problematic because it creates problems with public trust, but also makes it very hard to scrutinize response because often we don't have the data to actually scrutinize it because that data is clearly deliberately not being made available. I mean, a classic example of this is the variant of concern, that the Delta variant was actually designated a variant of concern later than it was supposed to because it was delayed until after the elections, which of course is a huge delay for a variant that's really, really concerning and poses a high risk to public health. And we can't have these things happening. And I think there needs to be accountability for these things. And I don't know how that happens in the current system where I feel there is large scale population level experimentation going on. And we are sort of still following this herd immunity strategy, but it's harder to scrutinize because our public health agencies are finding it quite hard to stand up to our government.
Yeah, brilliant. Thank you very much, Professor Gurdasani. Our next speaker is another stalwart of the campaign and a great MP, Richard Bergen. Richard is going to speak about the government's failure and how we must challenge them.
Thank you very much, Anima, and it's really useful to hear Professor Gurdasani set out the reality of the situation that we face. And I haven't switched on my video, it says. Is that right?
Yeah, we can't see you.
Apologies. 1 second. I'll start the video again. This is the kind of professionalism you need to fight COVID, you see. Just bear with me 1 second and I will sort it out. I'll tell you what, I'll just start, shall I? Yeah, there we are. Wonderful. Apologies. Once again, we've found ourselves, as I'm sure has been discussed, with longer restrictions needing to be imposed than should ever have been necessary, just as there's been more economic harm than necessary, and just as there's been more human suffering than necessary right throughout this crisis. And once again, this is the result of government failures. Time after time, government has got it wrong. Last summer, we had very low case levels. The experts said it was a chance to crush the virus, but the government at that crucial time did the opposite and cases spiraled out of control. In the autumn, as cases rose again, the government locked down far too late and released far too early, leading to tens of thousands of avoidable deaths. And now, when warned about the risk posed by new variants, the government refused to close the border, all because the Prime Minister wanted to go to India to pose with President Modi. Now, the government has been claiming that only hindsight can spot this pattern. That's simply not true. The government was warned time and time again, ignored the warnings. And once again, the government says that we should, and I quote, live with it. Now, I don't agree. Instead of living with it, we should be suppressing the virus. We need a maximum suppression strategy. That's what zero COVID is. I want to be clear, that doesn't mean more lockdowns. It's actually the way of getting our lives back to normal as possible. In fact, the countries in East Asia and the Pacific that have pursued a maximum suppression strategy have not had to resort to the national lockdowns we've had. What they've done is to put in place the proper public health measures, the very same measures that our government has refused from day one. Their death figures, their number of cases, and their economies and their people's quality of life have all benefited from this. So every time the government claims you can't suppress it and have to live with the virus instead, I think that we need to respond with the facts, because we've had over 1 year of evidence now, and the facts are clear. In the US and in Europe, where we've tried to live with it, death figures up to hundreds of times higher. Britain has had 1,900 deaths per million people. The US, 1,800 deaths per million people. Italy, over 2,000 deaths per million people. And Spain, 1,700, and France, 1,700 deaths per million people. Yet where they had a suppression strategy, it's much lower. South Korea has had 39 deaths per million people. That's over 40 times lower than Britain. Australia has had 35 deaths per million people. That's 50 times lower than Britain. New Zealand has had 5 deaths per million people. That's 350 times lower than Britain. China has had 3 deaths per million. That's 600 times lower. And Vietnam, 1 death per million. That's nearly 2,000 times lower. So we still need to be calling for the government to implement a suppression strategy alongside the vaccine. Now, of course, the vaccines are the best weapon that we have out of this crisis. But if we don't suppress it now through test, trace, isolate and support, it risks hundreds of thousands of more cases, many thousands more hospitalizations with huge pressure on our NHS. Many more will suffer from long COVID. Already 400,000 people are. And most worryingly of all, it creates conditions for new variants, perhaps even those invulnerable to the vaccine. So what are the measures that we need? I'm afraid that anyone logging into the meeting tonight who's heard me speak before is going to hear me call for everything I've been calling for over a year. But the failure to sort out these public health measures has led to over 100,000 needless deaths and prolonged the economic suffering and the human suffering. Firstly, we need to kick out the profiteers from test and trace. Testing's important. It's pointless unless you use it to then follow up on all the contacts of the infected people, testing them and ensuring that they isolate. Instead, we've got private companies with no experience trying to track down people and then get them to isolate from a phone call centre. That's not public health best practice. As Anthony Costello, a former director of the World Health Organization, has said, if we had copied the approach of Asia, then we would have had around 1 tracer per 1,500 of the population to monitor symptoms and help encourage isolation. That would be 45,000 tracers in England alone on the ground supporting public health. We need to invest properly in local health teams to do effective tracing. Instead, we're throwing tens of billions at failing private companies. Most of all, we need the government to finally sort out sick pay at real living wage levels. It came to light last week that the Tories hid from the public that they would use furlough to self-isolate if ill with COVID. The government did this knowing that many couldn't afford to self-isolate. Thousands would have been infected because the Tories hid this. People will have died, appalling. And it gets worse. Last week, I raised in Parliament the remarks from our government that the reason they refuse to properly financially support people to isolate when they have COVID is that people, in their view, would abuse the system. Apparently, people would game it, in the words of the Health Minister. Now, just because the Tory party is gaming the system to help their super rich donors, it doesn't mean the general public would stoop to their level. We need to keep fighting for proper financial support so that people don't have to choose between public health and putting food on the table. And finally, I just want to repeat the call from others for people's vaccine. That's because none of us are safe until everyone is safe. And there's a real risk of a mutation that's immune to the vaccines if the virus runs unchecked across the world. But we also need a people's vaccine because we have a moral duty to save millions of lives around the world. The world needs over 11 billion vaccine doses to end the pandemic, but the recent G7 vaccine offer falls well short. It leaves billions of people without protection. To ramp up vaccine production, we need a temporary waiver on the intellectual property so all countries can access the technology. President Biden supports this, as do another 100 countries. But we should be clear, it's our government, along with the German government, that is blocking an international deal on this. These vaccines were funded tens of billions of public investment. The vast majority of the funding was public money. And yet our Prime Minister is putting the interests of profit-hungry pharmaceutical corporations ahead of the lives of millions of people. Given it's our government that's doing this, I think we have a special responsibility to force it into a U-turn.
Thank you very much, Richard. Thank you. Our final three speakers will concentrate on different aspects of how unevenly the virus is affecting different communities, how unfairly the government is also treating those different communities, and what we can do in response. As Richard Horton from the Lancet reminds us, this is a syndemic where, in addition to the virus, poverty is an underlying driver of infection, of severe illness. Firstly, I'm delighted to welcome back another MP, Claudia Webb MP, who is a long-standing supporter of the campaign and a member for a Leicester constituency, one of the hardest hit of all areas in terms of restrictions and death toll. Claudia will share with us the experience of her constituents and the experiences of Black and Asian communities across the country. Welcome, Claudia. You're muted.
Here we go. I'm indeed unmuted now. Hi, I guess you can all see me. It's great to be with you. I'm just hot-tailing it from another debate, but actually it's a pleasure to join you all for this important event. And I would just like to thank the ZeroCovid Coalition, not only for inviting me this evening, but also for all the work you do in the service of public health. Today's event, of course, is especially important as we discuss, of course, the recent explosive testimony by Dominic Cummings, former chief advisor to the Prime Minister, which revealed, if true, the extent of the government's deadly handling of the pandemic. Now, whilst his trustworthiness is far from guaranteed, his testimony hammered home what we already knew about the government's appalling handling of the pandemic. The most shocking admission was that due to negligence, unpreparedness, and sheer arrogance, many thousands of people died unnecessarily because of decisions made in number 10, and yet no one has yet resigned. It was also unearthed, obviously contrary to government mistruths at the time, that there were significant PPE shortages, with British stocks continually being sent abroad, even as the pandemic accelerated. Cummings said that Health Secretary Matt Hancock should have been fired for at least 15 to 20 things, including lying to everybody on multiple occasions, and has since produced text messages, as we know, from the Prime Minister calling Hancock utterly useless. Bearing in mind, we are hearing from a self-confessed liar about a Prime Minister whom he branded a liar, who was surrounded by liars in government. Perhaps the most severe and deadly Hancock's lies was that despite persistent government promises, there was no protective ring around care homes in the early stages of the pandemic. This lack of preparedness meant that NHS staff were fatally exposed. Tragically, more than 800 NHS and care workers have died after exposure to COVID-19 amid a shameful failure to provide them with suitable personal protective equipment. This underlines the selflessness of those who dedicate their lives and put themselves at risk to help others, because any reasonable government would ensure that those who have contributed most to our national effort receive a fair compensation for the heroic efforts, including, of course, a 15% pay rise. Yet sadly, we do not have a reasonable government. The details of the negligence and sheer carelessness are sickening. Cummings confirmed that herd immunity was the initial policy of the government, which they knew would have cost at least more than 250,000 lives. Yet the government then lied that this was ever the policy, despite being on record saying exactly that, and got away with it due to a compliant media class. It should not have taken a disgruntled former employee to expose this government's deadly handling of the coronavirus. This was a damning indictment of our media ecosystem and reveals actually the cozy relationship between government and journalists, client journalists. Indeed, the only protective ring constructed during the pandemic was that which was thrown around the government by much of our billionaire-owned press. Boris Johnson's personal culpability and ineptitude was laid bare in that testimony. And as Johnson was said to regard COVID as the new swine flu at the start of 2020 and held a complete disregard for widespread loss of life, keen as he was to prioritize the economy over public health. What all of this tells us is that the mishandling throughout the COVID pandemic amounts to what Frederick Engels termed social murder. This is no other way, there is actually no other way to describe this government's handling of the pandemic. Everyone at the top of government associated with this utter calamity should, of course, resign. Every community has been hit by this crisis, but it has been especially impacted on the poor, the vulnerable, and the oppressed, including those in lower paid work and who cannot work from home. We know working class communities, African, Asian, and minority ethnic communities, the disabled, and those in poorer housing were amongst those hit hardest by this crisis. My community of Leicester East has been under lockdown or enhanced restriction longer than virtually any other area in the UK. The disproportionate suffering of areas like Leicester is a damning indictment of the government's failure to prioritise public health and implement a zero-COVID strategy to suppress the virus. Yet the government continues to make the same mistakes over and over again. With the concerning Delta variant on the rise and many more variants on the rise, the case has never been clearer for a zero-COVID approach that prioritises public health over private profit. This would avoid a cycle of confusion and ineffective local lockdowns. It would protect both lives and livelihoods by driving down the virus so that the economy can properly restart when it is safe to do so. The government's handling of the pandemic has been defined by a belief that it is a trade-off between health and the economy. It is clear which side they are on, as they consistently prioritise private profit over public health. Yet this is a false dichotomy. Our unacceptably high death rate is in fact largely due to the government's many attempts to prioritise the economy, from the initial herd immunity, the Eat Out to Help Out scheme, and the rush to allow people into high streets to do their Christmas shopping. The government must, of course, follow the best examples set by countries across the world, especially across East Asia and the Pacific, and adopt a zero-COVID strategy. This is the only way to prioritise the protection of everyone in the UK, and especially those who the virus has disproportionately impacted. But the government must also release and waive the patents. I mean, it's absolutely appalling that the Oxford vaccine, which was indeed funded 97% by the public, is not being released and shared more widely, so that countries, poorer countries, Africa, in Asia, in India now, that need the vaccine, that this is not being shared. The episode must be a wake-up call. It must lead to the widespread realization that our ruling class is fundamentally unable and unwilling to protect the lives of working people. Yet with the government responsible for social murder still running high in the polls, it is up to us on the left to continue to fight for a zero-COVID strategy, as well as a society which is built around people's needs, health, and well-being. Thank you.
Thank you very much, Claudia. Thank you. Our penultimate speaker is Helen O'Connor from the GMB Union. Helen will speak to us about how workers have been mistreated in the pandemic, how it has been used to introduce attacks such as fire and rehire, and what workers can do about these impositions and attacks. Thank you, Helen.
Thank you very much, and thank you for inviting me to speak. So it's clear that failures in leadership and delay in implementing safety measures have been a feature of the management of the pandemic from the beginning. And we've seen that the Delta variant has spread. It's now making up 99% of cases, and hospitalizations are going up as well. And let's be clear, the only reason people get admitted to hospitals is if they're seriously unwell or if there's a risk to life. So this is a serious situation. And once again, NHS workers are going to be at the front lines. They're going to be the most exposed to the virus because they'll be seeing those most seriously unwell with COVID-19 who flock to the hospitals for life-saving treatment. And hospital staff are telling us that this time, the people being infected are younger and most are unvaccinated. The vaccination program, which is successful, is being expanded and rolled out again, thanks to the NHS workers, many are who are working overtime to make sure that the population is vaccinated. But the other measures, as has already been said, to protect us from the virus are still not properly in place. Like the test, track and trace is just one example of this. And risks are being taken in loosening the restrictions in the rush to again open up the economy. And as has already been said, the economy is being put before public health once again. And all we've seen from this Tory government is arbitrary dates pulled out of thin air for Freedom Day, which was originally scheduled for the 21st of June, which they've now been forced to delay because of rising infection rates. And there's these empty suggestions going around that lateral flow testing, which isn't accurate anyway, can replace isolation. And a false sense of confidence that the pandemic will end is being manufactured by the mass media and the government in this country. And it's clear that the welfare of workers has never been a priority during this pandemic. And it's not going to be a priority either, even when restrictions can eventually be lifted. What we see is a push by big companies to get workers back into offices, even when those same workers wish to work from home because it offers them a better work-life balance. And it's still the case that many workplaces are flouting safety regulations. Some are removing safety regulations that were previously in place even, and it's still the case that it takes union organisation and a unionised workplace to hold negligent employers to account in this era of COVID-19. And there's been absolutely no learning from mistakes, there's been no apologies, there's been no public inquiry into the handling of this pandemic, and absolutely no accountability. No charges have been brought against anybody at the top of the system who are accused of corruption. And the Tories have used the cover of this pandemic to accelerate their public services cuts and privatisation programme, and they've been doing this behind closed doors. The pandemic has really exposed the lie that private is better than public. This has been manifested, of course, by the costly test, track and trace system, which has failed to stop the spread of the new variants of COVID-19. And the billions given to companies like Rent-to-Kill and others to manufacture PPE has led to hospital workers wearing bin bags and relying on face masks that break off in the middle of the shift. And unbelievably, private companies like Mighty and ISS have been cutting cleaning and catering services in our hospitals right in the middle of this pandemic. In Lewisham Hospital, the kitchens were restructured, leading to job losses and the quality of the food provided plummeting, and 495 cleaning hours were cut out of the domestic services in the same hospital. And in St. George's Hospital in Tooting, ward budgets, which are paying for 2 cleaners, are being cut down to just 1 cleaner now. There's been no discussion, no consultation. And Sodexo, a private company in Queen Mary's Hospital in Roehampton, also tried to cut domestic services, but the branch vigorously opposed this and they couldn't continue. Dominic Cummings' texts have confirmed what we already knew, that NHS workers were failed by this government during the pandemic, by a government that simply doesn't care. And we need to be clear, NHS workers have saved thousands of lives in very difficult conditions during this pandemic. They've delivered for the country when private companies who got 37 billion out of the public purse and even more by now have failed us. This Tory government has not only let NHS workers down in health and safety, they're now adding insult to injury by delaying the NHS pay anniversary. There's radio silence on the NHS pay rise, which is due every year on the 1st of April. NHS staff have already been subjected to years of having their pay held down. And this has led some workers now to be relying on top-up benefits. And the delay to the 2021 pay anniversary means that the outsourced workers, like the cleaners and the porters, who always have to wait longer anyway for a pay rise, probably will not get a pay rise at all this year. And inflation is now up 1.5 to 2.9%, and it's likely to rise even higher before the year is out. And what the driving down of wages in the NHS really means is that the most skilled and the most experienced people will leave, and this is dangerous for patients. We need to be really clear about that. We already have 100,000 vacancies and unprecedented levels of staff burnout from the warlike conditions created by COVID-19 in our hospitals. And now we're on the cusp of a third wave of COVID-19 and asking our exhausted, demoralized, underpaid and undervalued NHS staff to deliver for us again. It's a big ask, and that's why everybody needs to get behind the struggle for a pay rise for NHS staff and support our NHS staff. There can be no doubt that the mass vaccination programme also being delivered by our NHS staff is having some impact on the spread of COVID-19. However, in GMB, we have grave concerns about the move towards mandatory vaccination for care home staff, which is also going to be moving into the NHS as well, we think. In GMB Union, we're not anti-vaxxers. Our union has actually played a leading role from day one of the pandemic to put pressure on employers, to put in health and safety measures to protect workers going into work. And we were one of the first trade unions in this country to warn about the need for personal protective equipment back in March 2020, because our hospital members were telling us they were scared, they were telling us they were going to be left unprotected, and their foresight was absolutely correct. Our NHS members were effectively abandoned on the front lines of the NHS and left to work out how to deal with COVID themselves. Many were told to take their PPE off in hospital corridors in case they'd frighten patients, and many of them were left unsafe and unprotected. Many got sick, some died, and others have ended up with disabilities related to long COVID. And we are very disappointed that this Tory government is trying to shift the blame for their own failure and their incompetence onto the frontline social care and NHS staff when these workers have gone over and above to deliver for us during the pandemic. And the drive towards mandatory vaccination is giving the misleading and false impression that there's unvaccinated care home workers who are spreading COVID-19, when we know it's repeated failures in government policy that is leading to the further surge in virus transmission. And at no point during this pandemic has this Tory government bothered to roll out a decent public education programme to address vaccine hesitancy. And the divisive, racist and confusing messages put out by the mass media and government themselves has led to a degree of mistrust, which is not surprising and has led to some to question the vaccination programme. The no jab, no job policy advocated by the likes of Charlie Mullins of Pimlico Plumbers is terrible. And Pimlico Plumbers in particular is a company that has an appalling track record in the way it treats its workers. They even try to deny their workers rights like holiday pay. The no jab, no job policy is draconian. We actually think it's illegal and a breach of workers' human rights, and it will fail to address vaccine hesitancy because education and persuasion is far more effective to convince people than enforcement methods. And as a trade union, we are convinced that rolling out this policy across the care homes and the NHS will drive workers out of sectors which struggle to recruit at the best of times. The no jab, no job policy also fails to address the lack of adequate sick pay, because many private companies only offer SSP, which at £96 a week is impossible to live on. So workers cannot take time off sick when they get unwell. So we must reject all attempts by this Tory government to turn the public against the care workers and the NHS staff. We must oppose all draconian legislation that strips people of our human rights, and we must demand funding and investment in all public services, including the NHS and the social security system, which are now needed more than ever before. We must reject all attempts to divide vaccinated people against double vaccinated and unvaccinated people, and demand all rules around COVID, around any future lifting of restrictions, must include everyone, and no one should be left behind. We must demand a public education programme on vaccination as the vaccination is rolled out, because that still hasn't happened. And we need full sick pay for all so that people can afford to take sick leave, and full health and safety protections must continue in the workplaces. And another key demand is a full restorative 15% pay rise for all NHS workers who continue to deliver for the public during this COVID-19 crisis. And indeed, we should demand a pay rise for all of the frontline workers who've been the ones who've kept the country running right throughout this pandemic. So that's why we need to get serious about organising and building and strengthening the links between the trade unions and campaigns like this one and the People's Assembly, the trades councils and the social movements, because this unity will enable us to apply the type of pressure that's capable of bringing about fundamental change that can shift the balance of power and enable us to hold those in power to account and secure real justice and the resources that people need in society to thrive, have a fair chance, and to be healthy in the post-pandemic world. Thank you.
Thank you so much, Helen. Thank you. That was brilliant. Finally, tonight, I'm pleased to welcome back Ramona McCartney from the People's Assembly. The People's Assembly supports Zero COVID and campaigns against austerity and the wide-ranging attacks on women, Black and Asian people, workers, and the poor that this government is allowing or conducting in itself sometimes under the cloak of the pandemic. Thank you, Ramona.
Thank you very much, Nemo. Thanks once again for inviting the People's Assembly onto your broadcast tonight. And I know I've listened to all of your speakers and what great contributions they've all been. There's probably not a lot left for me to say after all that, but I think just to go back to a year and a half ago, where it all started, People's Assembly, like many other campaign groups, were shouting and broadcasting and putting events on every week, making sense of the crisis. We were speaking to infectious disease specialists, to doctors, to scientists. So we knew that there was evidence there that there was a way of actually somewhat avoiding the crisis that began to unfold due to the complete mishandling of the crisis by the government. That, coupled with the fact that we'd been living under Tory austerity for about 10 years, made the situation completely dire. It meant that without decent jobs, without properly funded NHS, without decent housing, with the cuts to disabled people, all of these things coupled together with the mishandling of COVID just absolutely spiraled into a huge crisis. And that's something that we can't ever forget. And we can't ever let this government forget, how complicit they are and the blood that they have on their hands for all of those deaths. So it was absolutely no surprise, actually, I think, for anybody when the confessions of Cummings came out a couple of weeks ago. I mean, just to think about some of the things that man said, I think he said something like, the cabinet secretary said, Prime Minister, you should go on TV tomorrow and explain to the people the herd immunity plan. And it's like the old chicken pox party where people get this disease and that's how we get to herd immunity by September. I mean, this is absolutely outrageous. And I know that they've mentioned and they said that, we will look to have a public inquiry maybe next year. It's not good enough. I think that that's something that we need to be pushing for right now. There has to be accountability, 100% accountability for this. Yeah, we are in a different situation. I guess now we do have the vaccine rollout, and I know a lot of your speakers spoke that it's no real silver bullet, but it is something that is helping. But I just wonder where all the corruption and the money, the 37 billion, at least that 37 billion, where all of that money has gone. The track and trace scheme, surely we can't have a proper rollout of a vaccine. Surely it can't be like at the height of success unless we have a world-class track and trace system coupled with that. And I think Dido Harding, who was overseeing that, is now looking to, she's looking to go for the head of NHS England. I mean, it's almost like we're living in some parallel universe where, what's going on here? It just doesn't make any sense at all. With the People's Assembly, just moving on to that, just shows us through the whole the Cummings confessions at that select committee how incapable they are. And sometimes incompetence is not a good word for them, because that's kind of letting them off with the hook a little bit. I mean, they're completely complicit in what they've done. They've got blood on their hands. And I think that one of the problems for us on the left and the Labour movement has been that we are trying our very best to do our best to keep safe, to keep our communities safe. You know, we are pro-vaccination and we want to go masked and sanitized. But the other thing that's happening is, while they can get away with packing the tubes and having unsafe workplaces, it feels like sometimes we're being silenced and we can't oppose it. And frowning on strike action, all these things. So the People's Assembly had organised, or we called for the national demonstration for the 21st of June, because that was, or for the 26th of June, because that was the first date really after the restrictions were supposed to lift on the 21st of June. Now they have pushed it further down the road. We are still going ahead with that demonstration. We are totally risk assessing the situation. We've handed all the documents in. We will have COVID stations on the day, plenty of masks free of charge for everybody, sanitizing, socially distanced. We will do our utmost best to make sure that we're COVID secure on that day. And the reason we think that we really have to go through with it is because they are being let off the hook right now. They're running amok. The corruption is at an all-time high. So we really need this Saturday, the 26th of June, to come together, all of the movements. They might have the ear of the media. You know, the right-wing press is running amok. They've got all of the money. We have the numbers, and that's how we have to defend ourselves. We do actually have to stand all together, unite as one big, strong movement. So all of the trade unions will be out on that day, all of the campaigns, all of the health workers, we're all joining together, and we're going to march behind a banner that says United Against the Tories. And we're calling, we have a lot of demands on that demonstration, and we need to demand all of these things after the pandemic. It exposed so much what's wrong right up and down every part of this country. What's wrong? It's they have assets stripped all of our nations to the bare bone, and it's time that we start putting things back together and demanding that we have a new normal. And this government are definitely not fit to govern, and we can see that very, very clearly now. So some of the demands on Saturday, and I hope you can all join us there. So we will be demanding to renationalise key services. We'll be demanding decent housing for all, demands to sack the corrupt politicians, please. We need properly funded, fully publicly owned NHS. We want to end the marketisation in education. We want to act now to tackle climate change. We need safe workplaces, and we need to save jobs. We need to end the fire and rehire. We do absolutely need a fully funded social care system. I think it's so important that we fight for that. And of course, we do need to end institutional racism, not like the Tories say that it doesn't exist. We need to end institutional racism. And we need to obviously kill the Police Crime and Sentencing Act. That's one of our key demands, and I think that bill is going to raise its head again this Thursday. I mean, how do we fight them telling us that they're going to suppress our rights to protest? I think we need to protest more. And also we want to demand for international solidarity and justice. So hopefully, come, wear your mask. Obviously, if you have any symptoms, please do not come. If you can take a test, that would be fantastic. Wear your mask, socially distance, but do join us and make sure that we have a big opposition to this government. We cannot let them keep getting away with it. Thanks very much, Nima.
Thank you so much, Ramona, and you're very right. You know, they may have the ear of the media and all the money and everything else, but we have the numbers. So, yeah, thank you for that, and thank you for the People's Assembly for organising the march on the 26th. That is the end of our meeting today. Thank you to all of our wonderful speakers. Thank you for joining us this evening. Please do follow us on social media, on Twitter and on Facebook, and also on YouTube. This meeting was recorded and it will be available on YouTube within the next few hours. Thank you, everybody. Have a good evening.